By the 18th of March 2020, more than 250 million people were in lockdown across Europe. It was only 5 days later that the UK joined them. To explain the delay, government figures controversially talked of wanting to avoid behavioural fatigue, while pinning their hopes on mass testing. In April, it emerged that the millions of antibody tests bought from China by the government don't work, while hospitals came to the brink of running out of supplies. After 4 days in intensive care with the virus himself, Boris Johnson told the nation the tide is turning.
If this virus were a physical assailant, an unexpected and invisible mugger, which I can tell you from personal experience it is, then this is the moment when we have begun together to wrestle it to the floor.
The summer saw 2 separate turnarounds on masks, with the government eventually recommending their use after initially doubting the evidence they work. A contact tracing app, promised as part of what Boris Johnson said would be a world-beating track and trace operation, was abandoned. And in late September, the public was told to work from home if they can, a U-turn on prior advice. England entered another national lockdown at the start of November, weeks after scientific advisors called for one, before shifting to a tiered system in December, with plans for relaxed measures over Christmas scuppered by a rapidly spreading new variant of the virus. As the country now enters yet another lockdown, there's one bright spot. The UK was the first Western country to approve a COVID vaccine and has now approved 2 of them. They're being delivered quickly, and the rollout is ramping up.